Good morning, Lorraine and Jacob. How are you doing?
We're doing good.
Following up on our discussion during your last visit, have you decided to start an IVF treatment as advised?
Yes, doctor, we have decided, but we would like more information about the process and also how our egg and sperm will be managed.
Sure, let me tell you more. On the day of your egg collection, your husband will be required to produce a fresh semen sample to be submitted to the IVF laboratory. The embryologist will then analyze the volume, sperm swimming behavior, and sperm count of the semen sample. After analyzing the semen sample, the embryologist will proceed to separate the moving sperm from the non-moving ones. While this is ongoing, you will undergo the egg collection procedure in the operating theatre located adjacent to the laboratory. Before starting the procedure, the doctor will pass the patient's label to the embryologist to verify the patient's identity. After confirming the name and identification number of the patient, the embryologist will start to examine the egg sac fluid under the microscope. All eggs are tallied and transferred into a culture dish, which is then placed in an incubator that closely mimics the environment in the human body. The transfer of eggs, sperm, or embryos in the IVF laboratory is always verified by a second embryologist, and the incubator will be assigned with the patient's details.
How do you decide that my eggs are suitable for IVF, ICSI, or both?
Depending on your fertility history, your preference, the quantity and quality of the eggs and sperm received, the embryologist will allocate the eggs to be fertilized by either of the two methods, namely for in vitro fertilization, IVF, or intracytoplasmic sperm injection, ICSI, or both. After egg collection, the eggs will undergo denudation. This process removes cells surrounding the eggs to better visualize them. The denuded eggs are then returned to the incubator to rest until ICSI. For eggs allocated for ICSI, a skilled embryologist will select the best suited sperm to be injected into a mature egg. For eggs assigned for IVF, the eggs and sperm will be placed together in a dish to allow the sperm to fertilize the egg naturally. A few days later, the embryo transfer will be carried out. Following an identity verification, the embryologist loads the embryos into the catheter and passes them to the doctor. The doctor will then perform the embryo transfer under ultrasound guidance.
How do you select which embryo is suitable for transfer?
The fertilized eggs are monitored 2 to 3 days later from the day of egg collection to track their development to embryos. The embryos are graded according to their cell number, shape, size, cell matrix, and fragments, if any. In our center, embryos are grown in the lab for up to 7 days post-egg collection. Embryos are typically transferred back 5 days after egg collection. However, An embryo transfer can also occur on day 2 or day 3 depending on embryo outcome. Embryos in their advanced growth, known as blastocysts, the advanced stage embryos, are scored according to the growth stage and expansion, as well as the prominence of the two main components within the blastocyst. These are known as the inner cell mass and the trophectoderm. The inner cell mass becomes the baby, and the trophectoderm the placenta.
What do you do with my remaining embryos?
Surplus usable embryos are frozen for future use swiftly by a method known as vitrification. Vitrification is a rapid freezing process. Embryos are introduced to a freezing solution that protects them from the harsh temperatures of liquid nitrogen at negative 196 degrees Celsius. The embryologist loads the surplus embryos onto freezing devices labeled with patient's particulars. The surplus embryos are stored securely in cryotanks that are monitored to ensure stable conditions are maintained. When you are ready to use the frozen embryos, we can schedule you for a Thaw cycle embryo transfer. A Thaw cycle allows you to defrost your frozen embryo when your uterine lining is ready for an embryo transfer. You will not need to reattempt the egg collection.
Just a final question, doctor. When and how soon will we know if we are successful from the treatment cycle?
You will be informed to return about 2 weeks after your embryo transfer to do a blood test to ascertain if you are pregnant. During those 2 weeks, you will also be expecting a phone call from the embryologist to update you on your embryo outcome.
Thank you, doctor. We have no further questions. Let's digest the information shared and we will get back to you when we are ready to take the next step. Okay, see you again.
Thank you. Bye-bye.